नहीं अब नहीं ना ना चुप
Child is suffering like this, in pain, in agony, cannot open his eyes.
Yeah, there is. You can see those dots. There's infection.
So they are really neglected. They are living in a very shabby situation in a corner. They are not living life without respect, just because they can't see and they are not productive.
That time I could not see anything, so I could not walk. So I was just sitting in the corner, and I was feeling very depressed. That how my life will be now.
Since 1963, Operation Eyesight has been on the front lines of the struggle against preventable blindness. In that time, more than 2 million people have been treated, their sight restored, their lives transformed. Many millions more have benefited from programs designed to prevent blindness, programs that Operation Eyesight pioneered and continues to expand to meet an ever-growing need. Fact: 80% of blindness is preventable. Today, in sub-Saharan Africa, well drilling is bringing clean water to villages where trachoma has ravaged the eyes of millions of people. Water is a key element in the quest to eliminate preventable blindness. With water, hygiene becomes possible. Clean faces mean fewer infections caused by the microorganism that creates scarring under the eyelids and that ultimately leads to loss of vision.
You see, this is a typical case. See, there's these ones which go up, then there's another layer which is going down, which are stumps of it. And these are the ones, when they grow, they actually rub on the eyeball.
Operation Eyesight is also helping communities to build latrines, to reduce the number of flies that carry the disease from person to person.
Those white dots, okay? Once you're able to count at least 5 of them.
12-year-old Daisy Macumbo's eyes have been scarred by the disease. Intervention by Operation Eyesight means her sight will be saved. Working with local hospitals and supporting local eye surgeons, Operation Eyesight is restoring the sight of many of those who have lost their vision.
Oh, now she's going to be able to at least look after her child.
Mass distribution of antibiotics in Kenya and Zambia is also part of the SAFE strategy to eliminate preventable blindness.
That's why we're saying in partnership with you people, okay? So that you own this just as we own it.
Communities need to be directly involved in the decisions that will affect them and the development of their own programs.
There's a cost to operating these wells, and the community needs to raise that money ongoingly so that they can continue to keep the well in good condition. The evidence from the past is that unless you do that, these wells fail, and that's a tragedy.
Fact: 2/3 of the world's blind are women and girls. In the slums of India, Operation Eyesight supports the work of Dr. Gopa Katari. Her sustainable programs are transforming entire communities.
When you see a slum community where Gopa's program is well established, there's economic and social vibrancy. There's so much happening. The children are clean, they're dressed in clean clothes, they're going to school. It's an incredible program. We've been able to support that with the help of Canadians, but we need to continue to do that, and we're appealing to Canadians to help us spread Gopa's program.
Fatima Kadar is widowed. She's once again working as a teacher. Fatima was unable to continue to help the children of her Mumbai slum or care for herself when cataracts took her sight away. Now, she is healthy, independent, and making a difference in her community.
She feels very happy that she got her sight back and she can continue working, and she is now an independent woman. She need not ask anybody for a help.
In a remote tribal area, Dr. Kotari is guiding a team of trained outreach workers as they help women and men to create micro-enterprise programs. They'll create income to buy nutritious food for their children, which will help to save their eyesight. Operation Eyesight is supporting local people to become educated in eye health, to become trained to help their own people. People like Arun, the son of a poor villager. He is now a skilled eye technician, traveling throughout the countryside, examining, diagnosing, and helping to heal the eyes of his community.
My life has changed completely because after I came back, I started seeing the cases and I feel I'm serving the people.
Fact. Restoration of sight and blindness prevention strategies are among the most cost-effective interventions in healthcare. In this community in rural Zambia, children can go to school clean and healthy because of Operation Eyesight's efforts to improve water and sanitation.
Because water is a problem here, especially in this village. Now when the boreholes put, at least now we can see children coming, washing, and even their clothes are being washed.
Better diets and eyes free of infection will make these children better students and more equipped to manage their own affairs when they grow up.
For the students, this is a great opportunity for them to actually learn the connection between water and health. For me, this is actually the best opportunity.
Fact. Without effective major intervention, the number of blind people worldwide has been projected to increase to 76 million by the year 2020. The need is urgent. Operation Eyesight believes in helping people to help themselves. We believe that partnering with local eye doctors and local hospitals is a truly sustainable approach that leads to the best possible outcomes. These partners are able to reach people who are unable to access proper eye care. At rural clinics, children like Jamal will have a chance to see again.
The whole cornea is melted in both the eyes, and now he'll need a corneal transplant in both the eyes to see again, and that is just because of vitamin A deficiency.
Operation Eyesight believes in the principle, the best for the poorest, in all of its partner hospitals. Patients with the ability to pay receive the same treatment as the poor who cannot afford to pay at all. That belief opened a new world for 80-year-old Babaka. For years she was blind, begged for food. There was no one to care for her.
Prior to the operation, I couldn't move. I used to sit in front of my house. I used to sit idly in front of my house.
Now, Babaka can move around her village, look after her own needs, find enjoyment in her life every day. Fact. You can see the difference that you can make in a person's life. By empowering people, by preventing blindness and restoring vision, you can enable a woman to run a small business.
She feels very happy now that she's been able to earn and manage herself and her husband's medicine as well.
Enable children to see their teacher. Enable a mother to operate a small business to support herself and her children.
She's grateful to Operation Eyesight for getting the operations done and restoring the sight.
Enable a farmer once completely blind because of cataracts to see again, to take care of his family, to regain his dignity.
He says he was very excited when he saw, because he never anticipated he would see, and to him it was like a dream.
There's a new spirit of hope spreading across the developing world, where people are discovering they can see, and they are seeing all that they have to offer. For all the world to see, OperationEyesight.com.